we're going to discuss about transport of drugs. So drugs are transported across membrane by two methods. The first one is passive diffusion and filtration, and the second one is specialized transport. So first we will focus on passive diffusion. So drug diffuses across the membrane in the direction of its concentration gradient. We know diffusion is occurring in the direction of concentration gradient, means the substances will move from high concentration to low concentration. Clear? Lipid soluble drugs diffuse by dissolving in the lipoidal matrix of the membrane, and the rate of transport being directly proportional to lipid water coefficient of the drug. If lipid coefficient will be more, then drug will easily diffuse. Clear? Now coming to the next, the influence of pH. So weakly acidic drugs such as phenobarbital or penicillin ionize more at alkaline pH. We know if acid will face basic pH, then it will dissociate, ionize, it will ionize, and if it will ionize, then it will become polar because they have charge, and the charged particles cannot cross lipid membrane easily because they are polar. Okay, so weakly acidic drugs ionize more at alkaline pH, so it will not be absorbed at alkaline pH. In same way, weakly basic drugs such as atropine and ephedrine ionize more at acidic pH. Okay, and it will not be absorbed well at acidic pH, means ions being lipid insoluble don't diffuse. This is the important point. And after ionization, ions are forming, so weakly basic drug will be less diffusible at acidic pH, whereas weakly acidic drug will be less diffusible at alkaline pH. Clear? So weakly acidic drug will be absorbed more at acidic pH, weakly basic drug will be at basic pH. This is showing here unionized. Okay, ionized will not cross the membrane. Now coming to the implications. What are the clinical implications of this fact, that is pH? So acidic drugs are largely ionized at acidic gastric pH. We know the gastric pH is acidic in nature, so acidic drugs will be largely unionized, so absorption from stomach will be more. In the same way, basic drugs are largely ionized in the gastric. Okay, basic drugs will be ionized, so it will be absorbed only when they reach the intestine, where they will face basic pH. Now coming to the one term, that is ion trapping. So the unionized form of acidic drugs which crosses the membrane, we have discussed that unionized form will cross the membrane. So unionized form of acidic drugs which crosses the membrane of gastric mucosal cell reverts to ionized form within the cell. Okay, within the cell they will face different pH, so they will ionize there, and if they will be ionized, then they will not leave the cell, and so ions cannot accept easily through the membrane. If it is captured inside a membrane and they are in ionized form, so they will not able to cross the membrane because they are polar compounds, so they are getting trapped. So this is known as ion trapping. Acidic drugs are ionized more in alkaline urine. Clear? So they don't back diffuse in the kidney tubules and excreted faster. Okay, if you are wanting that acidic drugs will be more excreted, then you will make urine alkaline. If urine will be alkaline, then acidic drugs will be ionized more, and if ionization is more, then it will not be reabsorbed. Clear? Now the next one is filtration. So passage of drug through pores in the membrane or through the paracellular space is known as filtration. Clear? Lipid insoluble drug cross biological membrane by filtration if their molecular size is smaller than the diameter of pores. Clear? So the filtration is for lipid insoluble drug whose diameter is lesser than diameter of the pores. Majority of cells have very small pores, and drugs with molecular weight greater than 100 or 200 are not able to penetrate or undergo infiltration. Clear? However, capillaries, okay, except those of brain, have large paracellular spaces of 40 angstrom, and most drugs can filter through this. Clear? So this is all about the filtration. Now coming to the specialized transport. So this is of two types: carrier mediated or vascular transport, that is endocytosis or exocytosis. Now depending on the requirement of energy, carrier transport is of two types, that is facilitated transport, but it is passive in nature, and it will along the concentration gradient. Passive in nature, but it will require a transport. Okay, so one example is the entry of glucose into muscle and fat cell by glucose transporter, that is GLUT4. The next one is active transport. It is against the concentration gradient, and drugs related to normal metabolite can utilize the transport process meant for this. Clear? One example is there, levodopa and methyl dopa are actively absorbed from the gut by aromatic amino acid transporters. Clear? Now the next point, in addition, the body has developed some relatively non-selective transporter like P-glycoprotein to deal with the xenobiotics. Okay, they are responsible for efflux of the drug. OATP, organic anion transporter, okay, organic anion transporting polypeptide and organic cation transporter are also involved in the transporting of the drugs. Okay, so this is all about your transport.